Hello, and welcome to Understanding the Tobacco Landscape, Community Trends and Voices from Kentucky. Whether you are a community health worker, a champion, a social worker, or simply someone passionate about tobacco prevention, thank you for joining us today. My name is Cassidy Most, and I am a community health educator with the Empower program. This webinar is the first of a three-part series aimed at supporting you, the people that are doing vital work in the community to prevent tobacco use and to support those on their tobacco quitting journeys. Over the next 10 minutes, we will dive into what tobacco use looks like in the state of Kentucky today, who is most impacted, and how we at Empower are using community voice to guide our work in Lexington and Louisville, Kentucky. You will also hear lessons learned from the feedback that we have gathered through our outreach and events over the course of our program. To begin, let's start with a quick overview of Empower. Empower is a CDC-funded program within the Prevent Alliance at the University of Kentucky. Our program is focused on reducing the use of flavored and menthol tobacco across Lexington and Louisville, Kentucky. We prioritize community-driven approaches by listening to local voices and by working closely with a group of community health champions, people from the neighborhoods that we serve, to help guide and spread the message. Tobacco use remains a major public health issue in Kentucky, with the state ranking in the top 5 adult smoking rates across the country. According to the CDC's Behavioral Risk Factor Surveillance System survey, 23.4% of Kentucky adults report smoking cigarettes. And it's not just adults. According to the 2021 Youth Risk Behavior Survey, nearly 1 in 4 high school students in Kentucky uses some form of tobacco. Flavored and menthol tobacco use have increased in recent decades, particularly among groups with disproportionately higher rates of tobacco use. When looking at menthol use in Kentucky specifically, 18% of all adults who currently smoke use menthol, compared to only 11% nationally. The CDC estimates that if menthol cigarettes were no longer available, an estimated 9,400 additional adults in Kentucky who smoke would quit smoking. These numbers are alarming, especially when we consider the long-term health impacts and the factors that drive them. Tobacco use does not impact everyone equally. Menthol tobacco, for example, is used at a significantly higher rate among Black Kentuckians. This is a direct result of targeted marketing by the tobacco industry over decades. While I mentioned earlier that 18% of all people who smoke in Kentucky use menthol products, 81% of Black people who smoke in Kentucky use menthol products. Youth are also more likely to use menthol products, as the menthol reduces the harshness of the smoke and makes it easier to begin smoking, whether that be in combustible cigarettes or other tobacco products like electronic cigarettes. Other groups that are disproportionately impacted include LGBTQ+ individuals, those who are Medicaid insured or uninsured, people living in poverty, and pregnant persons who smoke. These disparities are shaped by both historical and ongoing injustices, from targeted advertising to limited access to culturally appropriate cessation support. The tobacco industry has used deliberate targeted marketing tactics to promote menthol and flavored tobacco products. You will see these advertisements placed in Black neighborhoods, in corner stores near schools, and often paired with discounts or bright colors that appeal to young people. There is also a policy barrier. In Kentucky, we have a state law called preemption that prevents local governments from passing tobacco regulations that are stronger than state law. This means that even if a city wants to ban flavored tobacco or limit retailer density in high-risk neighborhoods, they legally can't. Preemption can make it difficult for communities to protect their residents in ways that make sense for them. In the face of these challenges, Empower takes a community-first approach. We believe in listening before acting. Our work is rooted in community-based participatory practices where we collaborate with the people who are most affected by tobacco-related harm to better understand their needs and to co-create solutions. How do we do this? Well, we gather feedback at local events through engaging activities like sticker boards and art-based interactions. We partner with trusted messengers like community pastors, local organizations, and barbers. We have a group of community health champions, people that live and work in Lexington and Louisville, to help us stay connected to the real stories and real needs of the communities we are serving. We also make sure that we are closing the loop by making sure that what we hear gets back to them. When people share their feedback with us, we show them how their voices shape what we do, through our social media, through our community boards, and through future events. This kind of transparency builds trust and accountability with the communities being served. So, what have we heard over the past 2 years? Here are a few common themes. First, people want culturally relevant support to quit. They don't want one-size-fits-all solutions. When people see culturally relevant resources, they are more likely to engage with you and be able to get connected to resources and support. Second, many youth know that flavored vapes are risky, but stress, peer pressure, and a lack of alternatives makes it hard for them to resist. When we asked students at a local high school about their perceptions of vaping among their peers, many reported that they believed that more than half of their peers were vaping. In reality, we know only around 10% of high school students in the U.S. are vaping. Hearing these perspectives can help us better understand what motivates the initiation of tobacco use and better try to prevent it. Third, there is confusion about what quit resources are available. People aren't sure where to go or who to trust. Historical trauma and distrust of healthcare systems can make it hard for some communities to seek support. And lastly, mental health is a priority in Lexington and Louisville, Kentucky. Of a total of 728 survey responses asking what respondents think is the most important health issue in their neighborhood, 30% reported mental health as the leading issue. We've heard all of this, and it's guiding the way that we are building our tools, designing our messaging, and offering our resources. When programs reflect the actual needs and the culture of the community, they work better. Trusted messengers like you can deliver messages in a way that feels personal and relevant. That's why your role is so important in bridging these gaps. If you are a community-facing professional, you don't need to be a tobacco treatment specialist to make a difference. People already trust you. You can be the person who shares a phone number, who hands out a resource card, or who connects someone to the support that they didn't know existed. You can help reduce stigma and offer encouragement, and it's often these small moments of connection that can change someone's path. As you continue working in your communities across Kentucky, here are some tools that you can keep in your tool belt. The Kentucky Quit Line is a free resource to all Kentucky adults that can connect individuals to coaching services and nicotine replacement therapy. The Quit Line is prepared to help with physical, emotional, and behavioral factors that are related to quitting tobacco. Services are offered by phone, online, or a combination of both. My Life, My Quit is another free resource that provides coaching to Kentuckians but is tailored to youth age 17 and under. Services are offered by text, phone, or online chat. The Substance Abuse and Mental Health Services Administration Helpline is a national service that is able to provide support to individuals who are facing mental and/or substance use disorders. And lastly, we have the materials that were developed by Empower. Empower is now offering quit kits that are intended for individuals who are ready to quit tobacco within the next 6 months. These kits contain helpful support resources like minty gum and toothpicks to ease cravings and fixations, a notebook that can be used to track triggers or to celebrate successes, and a stress ball to help them manage stress throughout the quitting journey. Each quit kit also includes a contact card to connect individuals to the Kentucky Quit Line. The design of these cards was co-created with feedback from community members to reflect the communities that we are serving. From quit kits to posters and other materials, we can provide tailored materials for your community. Or invite us to partner with events or speak to your organization because we are here to help you help others. Be sure to join us for the next sessions in this series. Session 2 will be supporting quitting journeys, tools and resources that you can share, and Session 3 is working with youth and countering the flavors trap. Each session is designed to build your skills and to expand your toolbox. Lastly, we want to thank you all for watching this video today. Please visit the Prevent website to access resources or follow us on social media to stay connected. If you'd like printed materials, Empower speakers, or quick kits for your community, don't hesitate to reach out. You will find all of our contact information on this slide. Together, we can build a healthier Kentucky, one conversation, one connection at a time. Thank you, and we will see you in the next session.